Hey there, I'm Megan Lynn.
And I'm Jill, and today we're talking about lip filler migration. Have you ever seen those patients that look like their filler has migrated out of their lip, almost looking like a mustache? Why does that happen?
So I've got a couple of answers. A lot of times I find that it's because too much filler was placed into too small of a lip originally. So a patient might come to their injector and say, hey, I want really big, voluptuous, blowout lips. But maybe they started with a really tiny anatomy and they just didn't have a lot of lip. We call it chicken lips. So they start like this. And then the injector goes and puts in a syringe all at once or two syringes all at once. And it winds up migrating up and out, and it's just too much for that lip to hold. Mm-hmm. So it needs to be done in steps if that's the goal. So that's one of the ways that it can migrate out. I've also seen this big full lip from just having too many injections too close together.
Right.
Sometimes too, it's just migrating from too much lip activity too close to being injected. So right as soon as you're done, you need to listen to your practitioner, and they're going to give you some great follow-up instructions and the instructions from what you should be doing right after your procedure. Right, Jill?
Sure. So touching on some of those post-care instructions after you've had your lips filled. Probably the most important thing is don't touch your lips. We've given you beautiful lips and we've used a needle to get in there, and now you have all these open injection sites, and the last thing we want is for those to become contaminated. So don't touch your lips. Some lumps and bumps are totally normal. Before we send you out the door, we're smoothing product to make sure there's no lumps of product. You might have localized areas of swelling, and that's completely normal. Over the next week or so, it will just smooth out with normal facial movements and smiling and chewing. So don't be alarmed. Don't touch your lips. No excessive use of your lips for at least 24 hours. So don't use any straws, no excessive kissing. You get the gist. We really don't want to displace that filler anywhere except for where we've placed it. Don't elevate your body temperature. I really would prefer if you don't work out the day that you have your filler placed. The following day you can work out and resume normal activity. And then the last thing is don't use old lip products on your new lips. Everyone's excited to put lip products on their lips because they look beautiful and plump, but if they're old, they're contaminated. And again, we don't want to risk infection. So get a new lip gloss or something like that, Aquaphor, Vaseline, something that'll keep your lips really moisturized because they do tend to dry out after the procedure, and use that. Don't use any old lip products. So anything else to add?
Nope, that's it. Just make sure you're listening to your injector. If you're a patient, really follow their instructions, take them seriously. And if you're an injector out there, slow and steady. Don't let the patients kind of push you around. If they want big lips, we can absolutely accomplish that with the right techniques and the right amount of time.
Right. Rome was not built in a day, and neither are lips. So thank you for watching. You can subscribe to our YouTube channel, comment below, and we look forward to seeing you soon.
Thanks, guys.